Okay, so the B question, the first question is about disease and infection. The B question is going to be about surgery. So remember, surgery is in these three categories about pain, infection and bleeding. So you may have a question like this. Choose one of the medical pioneers, Lister or Simpson. What did he do? 4 marks, so just choose one. And remember to stick to the BDA before, what do they do, and afterwards. And then the second question, who contributed most? And I think the key thing here is what you must do. If you choose Lister first, for the A question, answer that. For the B question, start with Simpson. So this is what Simpson did. So think about the positive things that Simpson did as well. And then try and evaluate, explain at the end about Lister, and then come to a conclusion at the end. That's the important thing. So that's worth 8 marks. You should be writing double for that. So let's just go through the key people. So Vesalius. So before Vesalius, really people were relying on the workings of Galen in particular, who'd primarily had used anatomy based on pigs, monkeys, etc. What did he do? Well, we know he stole bodies and he boiled them down and he correctly placed them all together. And importantly, afterwards he published them into his book with the drawings by Da Vinci, which spread very quickly around Europe. Paré. Before Paré they used cauterization to seal wounds, which is incredibly painful. What did he do? Well, he invented the ligature to stop this problem of bleeding, and his ointment, which obviously also helped and develop on from cauterization. What did he do afterwards? Well, again he wrote a book which spread his ideas around. Harvey. Before Harvey, they believed that the blood was generated by the liver, and which was not correct. What did he do? He used that basic experiment we watched, where effectively he calculated that it was impossible for the liver to produce that amount of blood. So he came to the conclusion, using the experiment, that the heart acted as a pump. What happened afterwards? Well, things with improvements in microscopes, they discovered capillaries and how it moved across the heart in that respect. Simpson, I always remember this because at home was on the sofa. Basically, before Simpson, people relied on anaesthetic. That was alcohol, laughing gas, ether, etc. All of those things were not safe. The patient was not unconscious. What did he do? Well, he was experimenting with chloroform and he realised that it was an effective anaesthetic. However, patients died sometimes because they took too much of a dose and it killed too many brain cells and they went unconscious into a coma. Afterwards, John Snow developed an inhaler which regulated the intake of the anaesthetic. Lister. Before Lister, really, doctors, or really before Pasteur, doctors were unaware. We know the story of Semmelweis, unaware that germs cause disease. What did he do? Well, he developed, and he had that eureka moment with the sewage smell, he developed that carbolic acid, which sprayed a patient over an operation which killed germs. Afterwards, it took him a long time, but afterwards it led to sterilised operations. Mackindou. Before Mackindou, plastic surgery was very, very basic, and a lot of the victims from the First World War ended up killing themselves because committing suicide because they couldn't cope with the aftermath of the operation and the way people were staring at them. What did he do? He improved the pedicule treatment, and then particularly the treatment of the nose, but importantly he took patients out into the public eye and enabled them to develop mentally from their scars. Afterwards, really, he's recognised as the father of modern day plastic surgery. So you also may have a question which is a factor question. So that individual question is reasonably straightforward. Again, the structure here is very, very similar. Choose one of the factors of war and government. How did it improve surgery? What contributed most? So let's take war. So let's look at this. So during Greek times, obviously they were fighting each other and they developed ways to help wounds. Roman times were the same. They had people called medici, which helped people. In medieval times, there was a lot of war going on, which actually took money away from improving medicine. In Renaissance times, that's Paré, really. He was fighting the battles there. 19th century, again, wars were going on, and this is really about bigger weapons, the development of weapons, different types of wounds, that type of thing. But the most important period was the 20th century, and primarily the First World War. So that was things like X-rays, blood transfusions, skin grafts, development of surgery, and the need for proper anaesthetic